I'm Juan Politei, I'm a neurologist from Argentina, and now I will comment some of the consequences of the late diagnosis in Fabry disease. These consequences are related to the dysfunction of three major organs. I'm talking about the brain, the kidney, and the heart. In the case of the brain, we used to talk about the presence of a stroke or cerebrovascular ischemical involvement in the brain. We are using today the MRI, the brain MRI, as the most important tool. As you can see here in the pictures, the presence of ischemias are related to the damage of the small branches of the brain vessels. So cardiac involvement usually starts after the third decade with the presence of arrhythmias or the presence of left ventricular hypertrophy. With the use of cardiac MRI, we can check the presence of endomyocardial fibrosis with the use of gadolinium and the presence of the late enhancement at the endomyocardial level. Kidney involvement is very important because it starts not at the age of 40 or 50. Now we have evidence that if you indicate kidney biopsies in patients with the type 1, you may find substrate deposit at the level of the podocyte before the age of 20. This is very important because it's talking to you that the damage at this level is present. When you lose all your podocyte, you will see what we call the proteinuria, and then after proteinuria is present, you cannot reverse the proteinuria. So keep in mind, it's very important to do the diagnosis of the kidney involvement in very early stages. So diagnosis of Fabry disease is based in the assessment of the enzyme activity. In the case of males, if you found a very low enzyme activity in the dry blood spot, what we call the DBS, could be enough for the diagnosis, but usually we check these abnormalities measuring the same enzyme activity in leukocytes. In the case of females present, as you heard before, 2 eggs. So in this case, we usually go directly to the molecular test because the 50% of the female, even being Fabry patient, they may show you normal range in the enzyme activity. Some exceptions need the confirmation using tissue exams looking for the substrate, or you can assess the plasmatic level of the substrate, the plasmatic level of the lyso-Gl3.